Thank you. As you've heard from the speakers today so far, curbing healthcare costs is a huge challenge and all the more urgent in light of the current financial and economic challenges we're facing. I'd like to start my remarks with 5 quick factoids that, at least for me, help frame and dimensionalize the nature of the challenge. And then I want to talk a little bit about why Americans pay more for healthcare than other developed countries, and then talk at the end about a few principles for reform that I think might be helpful. First, a handful of factoids. In 2006, as Joe's chart showed, the average Fortune 500 company spent more on healthcare than they made in profits. In a normal year, that's going to continue, and this year it's going to be much more. Secondly, in the next 3 years, the average state government in the United States is going to spend in excess of 70% of their incremental tax revenues on funding Medicaid. In states like New York or California, where revenues are going to be quite problematic, it's obviously going to be a lot more than that. That leaves precious little for education, transportation, public safety, or anything else. In 2006, the United States spent $2.1 trillion on health care. That's more than Chinese citizens consumed on all goods and services in the same year. Or an example closer to home, it's 3 times what the bailout that Congress approved was. Growth in healthcare spending, not the absolute level, but growth between 2003 and 2006 exceeded $400 billion. That alone is more than Americans spent on oil and gas during all of 2006 when energy prices were beginning to peak. So we're talking about some very large numbers. Today, the U.S. spends more on healthcare than any other developed country, and that share is rising. Let me spend a couple minutes explaining why that's the case. I'm going to draw on a 2007 McKinsey Global Institute report on healthcare that will be updated and released at the event that Charlie mentioned earlier that CED and New America Foundation will be hosting in January. MGI developed a measure we call estimated spending according to wealth. That compares data from 13 OECD countries and adjusts healthcare spending according to GDP per capita. So it's anchored in the fact that countries, in fact, spend more on healthcare as they get wealthier, just as you might buy a bigger home or a better neighborhood as your income rises. So what did we find? Our research indicates that even after adjusting for wealth, the U.S. spends nearly $500 billion more a year in healthcare than we would expect, without any significant increase in health outcomes. And the trend is worsening. We found this additional spending pervasive across the system. There's no silver bullet. It's peanut buttered everywhere. Consider the sources. Of the more than $500 billion that we spend above what we might expect, about $225 billion is found in hospital care and another $178 billion in outpatient care. Together, these two, the delivery system itself, account for 80% of the U.S. spending above what we would expect. It's worrisome that both of those levels grow at twice the rate of GDP. With the other categories, the U.S. spends above its wealth levels. Almost $100 billion is in administration and insurance, $57 billion in outpatient drugs, and $19 billion in public investment. So that's the basic math, $500 billion more than we'd expect relative to other countries adjusted for wealth, spread all over the place, 80% of it in the delivery system, the rest in administration, drugs, and public expenditures. You can get a lot more detail on this if you want, the report that's outside, and there'll be an updated picture on it when we release our report in a couple of months. Suffice it to say, the picture's gotten worse. When we ask why the U.S. spends so much more than expected, our analysis points to several factors. First, as Bill said, the laws of supply and demand function very differently in healthcare than in other industries. Incentives are misaligned and favor participants at the sake of patients. Finally, there's a complete lack of value consciousness on the part of patients and employers. When you combine that with the ongoing growth in costs, we obviously find ourselves in an unsustainable situation with healthcare costs growing at twice the rate of the economy without adding any incremental value. So what should we look for in the elements of reform? Without getting into a bunch of detail about particular proposals, let me offer some broad principles that we think are important to have any likelihood of success in healthcare reform. First, we need to have the involvement of all the major stakeholders. Hospitals, payers, and doctors are critical to the delivery of the health system, and without their engagement, it's going to go nowhere. You as employers play a key role in terms of working with payers to address the misaligned provider incentives and ensuring that employees get the health care they need while consuming in a value-conscious way. Figuring out how to do more for less is going to be a national imperative, and business can lead the way here as it's done in other sectors. Second, reforms are going to have to protect innovation and leadership, which define our current system and is the strength of the U.S. economy overall. Third, to generate political support, any major proposal is going to have to take into account prevailing social values, notably the value placed on extending life, individual choice, and equality of access. Finally, we'd suggest, given the nature of the cost challenge that I described, which is in fact systemic and not isolated to any individual piece, piecemeal healthcare reforms are not going to make much of a difference on the overall cost of the system. Current proposals that attempt to broaden healthcare access are going to drive costs even higher unless they address the underlying incentives that are misaligned in the system. While there are a lot of possible paths through this, reform efforts won't succeed unless they address both the supply and demand side of the equation and create the right incentives for those who consume, provide, and pay for health services. One last thought, just to echo what Bo was saying. Employers now more than ever are the linchpin to any reform effort. The level of attention and energy that you as employers give to healthcare reform in the next while, particularly since the focus is going to be much more around cost and productivity and value consciousness, is going to be a deciding factor in determining whether anything actually gets done this time.